Welcome to PSW Podcast. My name is Miranda Romanovic. I'm the CEO of the Ontario PSW Association and the Canadian Support Workers Association and host of PSW Podcast, where we come to you guys live every single Friday at 11 a.m. and we bring out interesting guests. We talk about the good, the bad, the ugly of working in healthcare as personal support workers. And I am so thrilled to have joining me today from the Nurse Practitioners Association of Ontario. We have Michelle Acorn, the CEO, and we have Valerie Winberg, who is the chair of the NPLCA, which is the private clinics that are run by nurse practitioners, correct, Valerie? And of course, an NPAO member. So we're here today to talk to them about inside the nurse practitioner role, what PSWs need to know. So welcome, ladies, to this conversation today.
Good day.
So much. Great to be here.
So it's going to be an interesting conversation. I think, NPs play a vital role in Ontario healthcare, well, across Canada, really, truthfully. They play a very vital role. And it's going to be interesting to get into conversation about how the PSWs and NPs work together, how PSWs can become nurse practitioners, because that is a thing and it can happen, which I think a lot of PSWs don't know. But first and foremost, I'm going to introduce you guys so they have a better idea of who you guys are. I'm going to start with Dr. Michelle Acorn, who is the CEO of NPAO. And Dr. Acorn has over 35 years of nursing, health systems, and leadership expertise. Nurse Practitioner Acorn transitioned to her NPAO CEO role in 2024. She previously was the inaugural chief nurse with the International Council of Nurses, a former provincial chief nursing officer in Ontario, and has served as a NPAO president. So that's impressive, Michelle. So welcome to this. And of course, Valerie Winberg. Valerie has over 35 years of nursing experience, starting as a diploma prepared RN, and then advancing to her master's and NP certificate in 2003 in primary health care. She is also a clinical wound specialist. Valerie has been forming interprofessional teams with an aim to improve patient outcomes through access to providers and evidence-based care locally, provincially, and nationally since 2008. So welcome to the conversation. Impressive, ladies. Now it's a bit intimidating, not gonna lie. Both of you guys have a lot under your belts. That's amazing. So I'm gonna let you guys choose what you want to speak about. Maybe you both want to speak about the topic that I bring up or the questions that I ask. But I think the first one is understanding the nurse practitioner role in Ontario for our personal support workers. So what is a nurse practitioner and how does your scope of practice differ from a registered nurse or a doctor?
You want me to start things off, Val?
Sure, go ahead.
And by the way, Miranda, thank you for your stellar leadership as well. We have nothing to be intimidated about. We all bring different talents and thought leadership and expertise. And I personally want to thank all the PSWs that are online for all their dedication and service. I've worked with many PSWs along the way, and I think we need to talk about the realities and opportunities as well. I'm going to get started. So as the Nurse Practitioner Association of Ontario, we exclusively represent, just like you represent PSWs, we exclusively represent the 6,000 nurse practitioners in Ontario, by the way, which is almost 50% across Canada are housed actually from Ontario as well. A lot of people may not know that. Our association has been alive, well, and thriving for almost 50 years, and we really focus on supporting nurse practitioners and full integration across the healthcare system as well. So nurse practitioners, what are they? What are we, I should say? We're autonomous. That means we're independent. We are regulated and licensed health professionals, and we provide comprehensive care across the lifespan from birth, all ages, all stages, all sectors, for example, as well. We are educated as first registered nurses, and that is at a baccalaureate level, and then we continue on to a master's graduate level or a doctoral level as well. Such many of us have our DNP, Doctor of Nurse Practitioner, or Doctor of Nursing Practice, or a PhD as well. We always break down about what we do, and it's not tasks. It's actually scope of practice. So I'm going to talk about the clinical things we do, and that would be comprehensive assessments. It could be diagnosis. It could be treatment. Managing acute and chronic illnesses, for example. We can order, interpret all kinds of lab tests, CAT scans, MRIs, ultrasounds, for example. We can prescribe all medications, including immunization, prevention, for example, all the way to chronic diseases or pain management, such as opioids and even medicinal marijuana. We can actually assess and do provision of medical assistance in dying as well. We can admit, treat, and discharge from hospitals and long-term care. We can be your most responsible provider. We work in teams as well with PSWs as well. We can refer to specialists. We can collaborate with all the other interprofessional team members as well. And we marry nursing and medicine together. And that's the difference. We also are not just clinicians, but we're leaders, we're educators, we're quality improvers as well. And I think I'm going to stop there because I'm going to punt over to Valerie to talk a little bit more about, for example, the sectors that we work in. And she's an expert, obviously, in the nurse practitioner-led clinics. And we can talk about what the nurse practitioner-led clinics are in the public sector as opposed to some of the private things that are happening, if that's okay with you, Miranda and Valerie.
Absolutely. Again, thanks for having us. And I personally have worked as a nurse practitioner in pretty much all the settings. I used to do rounds in long-term care, and I've worked in with a solo fee-for-service physician as an independent contractor. I worked for 8 years as a nurse practitioner working in the emergency department, seeing the lower acuity patients. And now for the last 15 years, started up a nurse practitioner-led clinic in the area where I live. So, in the nurse practitioner-led clinics, I think there's a lot of confusion in the public as to, which ones are really nurse practitioner-led clinics, and there's a lot of people setting up and labeling themselves as NP-led clinics. But the nurse practitioner-led clinic model that I represent and that I work in is the government-funded one that includes interprofessional teams. So the clinics will have a variety of team members depending on which clinic it is. So everything from health promoters and social workers and psychotherapists, RNs, RPNs, dietitians, physiotherapy. Some clinics have foot care nurses as well. So it all depends on sort of community need and what you end up getting funded for, to be honest. And so it is a great model. And the difference between the nurse practitioner-led clinics and some of our other team-based models of care is that the care is managed by the nurse practitioners all the way from at the board level. We strive to have 51% of our board members to be nurse practitioners. And then at the executive level with NP leads at every clinic where they're doing an executive director role, leading the team, leading the HR, writing proposals to the ministry, engaging with your community stakeholders in your local Ontario health teams and primary care networks. And that's where the healthcare leadership piece comes in. So I don't know if you want me to stop there, you have another focus of another question.
No, I think that's wonderful. And I think that it's important that people know that, because I'm going to be honest, I didn't even know that. And it seems to be Ontario's biggest secret. Is the power of the nurse practitioners, right? And what you guys can do. I will say, just as a bit of a personal story, is my daughter, who's 18, she sees a nurse practitioner, and she always felt that she wasn't being heard by our GP, who is a wonderful GP, but he's older, he's male, and she had a nurse practitioner, female, who completely helped her out with some of her girl issues, shall I say. And she says she felt so comfortable talking to her, and it was just a different vibe. It was more personal. It was more, more direct. She felt like a human being when she was dealing with this particular nurse practitioner. So, I think a lot of us just don't get it. But it's important that we do because you guys play such a vital role in Ontario healthcare. Now, I think the question now would be collaboration in practice. So, I mean, we have all these wonderful, medical professionals in Ontario. We have physicians, we have you guys, we have the nurses, we have RNs, RPNs, and then we have personal support workers who obviously I'm going to bring into the conversation because PSWs obviously provide all the bedside care across Ontario and Canada, especially in our long-term care homes. They go into home care. They do a ton of the heavy lifting from the bottom end, which is a very important place. Now, how could you guys see, like, how do PSWs and nurse practitioners collaborate? Is there an example of that collaboration? Is there kind of what you guys foresee for the future where NPs and PSWs could work together? Tell me your thoughts.
Yeah, I'm happy to start that. Val actually shared what some of her experience, and I thought maybe I better do that. People see me in executive leadership like you, Miranda, and or as Valerie is also practicing, and she's the lead. They don't see us sometimes in the clinician piece where we know how to get our hands dirty. We have relevance. We do direct patient care as well. So I was actually hospital-based for almost 30 years at Lake Ridge Health. And when you say, how do we actually collaborate? I worked in the emergency department as a hospitalist. We started the first nurse practitioner-led hospital, where the nurse practitioner was the most responsible provider from admission to discharge. And I was the MRP on the floor in post-acute specialty and dementia. And my colleagues, my valued colleagues, were PSWs, and they were helping us with a lot of obviously direct personal care, behavioral support for responsive behaviors and things like that as well. I've also practiced with PSWs in retirement homes. Also, and that is a huge opportunity because many times they're coming in from the home and community sector, as you know, and they're the eyes, ears, and voices on the ground to alert if they have adequate care services or what their needs are, and sometimes the conduit between families to pass on the information as well. And we've also practiced together in long-term care. So I also did long-term care in Newcastle. And I can tell you the PSWs know exactly what's going on. They have that continuity in the care, and they know exactly when there's a change in conditions, like acute delirium, or when people are off their baseline, really resident focused, and hugely in part of the team. When you say, how do they collaborate? Well, it's not just with the nurse practitioner or physician, but with the RPN, for example, the RN and the rest of the teams as well. I think that we need to think about as what that looks like for first point of care along all the settings. And there's other areas that are underutilized for PSWs. And let's be honest, that's because of funding, as well as some of the evidence on what they're studying and who can contribute in what areas. That contribution looks like. And it's not just ratio based or things like that as well. It's utilizing people to their top of their abilities as well and communicating them. Miranda, I'm going to be bold today, but you and I have also talked even how we talk about the team composition. So NPO has put out some really good infographics lately on what does a team look like. And we have the usual composition, and we'll talk about primary care today because NP Winberg is here as well. But, we tend to always think the same professional hierarchies, and they're not hierarchies. We're across the continuum right now. And sometimes I think we need to be more deliberate and intentional to ensure that PSWs are part of that. And when it's not just direct care, it's the communication, it's being involved in councils to know how you do change management and things like that, I think are really important because as we have increased partnerships and that collaboration in the interprofessional teams, we really need to ensure everybody has a seat at the table and the voice as well. And what that looks like, even across the landscape on Ontario health teams, for example, it's not just primary care, that could be hospital-based and long-term care as well. And I think we need to have some of those conversations. And I'm going to punt over to you or Val next.
What are your thoughts, Valerie?
Well, I was, in thinking about today, I was thinking about, where do I intersect with PSWs on my day-to-day clinical work? And when you work in primary care, it's a different presentation day to day, but I would say there's many instances where a PSW is the accompanying person that will bring someone to their primary care appointment.
Yep.
So, they're certainly in that supportive role to help families, if the next generation is still working or out of town or whatever. Oftentimes, it's a PSW caseworker that will bring them to a primary care appointment and then serve as the eyes and ears, not just for the patient, but for the family who are also concerned. The other way that we intersect fairly regularly, well, along with retirement homes, because of course those folks attend their own providers and don't have a medical director in house. So see lots of folks from retirement homes who, again, they'll either be accompanied by a PSW or maybe there'll be some communication that will be sent forward from a PSW. And the other places from our community services partners, there's certainly the Ontario Health at Home. That's sort of the more formalized one that people are most maybe familiar with, but there's so many community support worker agencies, more numerous than I can talk about in one session. And pretty much all of them will employ PSWs in a variety of roles. And so we intersect with those PSWs in primary care a lot because, again, they're the connecting point with those community service agencies as well. So very valued contributions. And I know, we were talking about your daughter and her experience with an NP. And I would say that that's not an uncommon bit of feedback. And I think that speaks to the lens that nurse practitioners practice from. We start in a nursing field, right? And so when you do nursing, you're used to doing family care plans and care plans for patients. And so as nurse practitioners, we bring that foundation of how we're used to dealing with families and working together with families to that next level where now we're not just taking a family history or writing that down, we're actually diagnosing and treating and managing their care 100% as their most responsible provider.
Yeah. No, and that's interesting, right? Because I can almost guarantee you that the majority of PSWs watching this don't realize that they're actually dealing with a nurse practitioner.
Mhm.
I kind of, like that's kind of the vibe I'm getting. And going back, Michelle, to what you said about like the professional healthcare teams and how PSWs are not, let's just be honest. You want to be blunt, I'm going to be blunt. We're not involved
Mhm.
in really anything to have to do with the people that we care for 24/7, which to us is astonishing. And I know we've had these conversations in length, Michelle, in the past about how the PSWs bring that vital information into these healthcare teams and should be included in these discussions that surround these residents or patients or clients, because who's going to know that Mrs. Smith likes to have her feet get cold at night? Well, who's going to know that? The personal support worker. And that might be a very important thing that people need to know in order to realize maybe she's diabetic. Who knows, right? But we're never asked. So I appreciate you mentioning that. And that is another battle for our association, is to really allow the PSW's expertise to shine, because I don't think we're allowed to shine. We see quite often here on the podcast is a lot of PSWs were set up to fail. We never have enough supplies. We never have enough help on the floor. We never have enough. So if we don't have all those things, how are we supposed to do, our job to the best of our ability for the people in our care? Well, we can't. So you're set up to fail, unfortunately. But it's nice to know that we have some friends at the Nurse Practitioner Association that see what the PSWs do on the regular. So let's talk a little bit now about addressing gaps in the healthcare system. Because I know like PSWs are being looked at to possibly fill certain gaps in our healthcare system. But where do you see the nurse practitioner? What are you guys doing in order to fill those gaps?
We're trying to change the narrative. Nurse practitioners are viewed just like PSWs are viewed filling the gap. We're not gap fillers.
right?
We are a permanent solution that must be integrated across the healthcare system and part of the core health strategy, health workforce strategy, as are you. So maybe we need to be a bit more deliberate and intentional and not be known as temporary gap fillers. And to your point, I need to go back because I can't let that go. We're not asking permission. We
No.
are vital. And I think you obviously have strong leadership here right now, but we need to think about being a bit more embarrassing. We're not asking permission. We deserve a seat at the table, and part of that, whether it's care conferencing or updating your resident stories of our stories, or information that's personal about the residents. I think that's important. But what we do have is power, and we have statistics. And I know people don't like talking about sometimes the evidence or statistics, but what is critical right now, and especially from PSWs, is there's a critical shortage of PSWs. And what we're not talking about, you can recruit, there's challenges we can talk about, with compensation and, onboarding and stay boarding so that they stay in roles but retention is a huge issue. Similar to nurse practitioners, we share a lot of the same issues as well. So if we're going to think about actually what could be a great retention strategy is some of these structural or cultural changes that you have within organizations or systems to say, you know what, here's a PSW report. Here are some of these things as well. It could be easily actually integrated in healthy ways as well, and or showcasing. We showcase a lot as well. So I don't want that to change. And by the way, when we talk about career trajectory, you talked about your daughter. My daughter has gone back and she was a registered practical nurse. And now she's a registered nurse, and I don't know why she's thinking about nurse practitioner. I assure you, I didn't actually intentionally tell her to be a nurse practitioner, but I might have role modeled that. She's interested in it. We have 2 NPs in our association that I know of so well that have done the full track from PSW to RPN to RN and NP as well. So, we were going to talk about that as well in the Begin program, but we are not thinking about where PSWs are integrated. We have the same areas. So I actually practice in corrections. So I look after young offenders at the intersection of health and justice. And I also look after human trafficked and exploited youth, for example, as well in the community while I do my executive leadership. We have many, many different opportunities. And I think when we think about how we're actually integrated right now across the system, we need to maybe look at the team composition and also not just direct care, but what that actually the team, not just team dynamics. I would almost say when we have, your team meetings and your care meetings, you do have to flex to ensure, patients are covered as well, but everybody deserves to share their information. And I know my colleagues, my PSW colleagues actually have very, very great, as I call it, intel on people as well. And we have a great relationship. They will come up and speak with me directly about that. And it's very, very reliable. And that really helps as well if you feel that you have direct communication versus indirect communication with part of the team as well. So I just want to kind of talk about that a bit.
Yeah. I mean, and you make perfect sense, and you're right. We're not a temporary replacement. It's always very interesting to me how, and Michelle, again, we've had this conversation before, how PSWs and nurse practitioners have actually been in the same boat a lot of the times, trying to fight for that recognition, fight for that, that place that we should be. And, I think what's interesting to me is that you talk about new teams, right? Looking at how to provide care moving forward, and not just looking at, like, going back to what you said earlier, the hierarchy. So like right now with PSWs, it's always, we're working with an RPN or an RN. Well, why can't you just have a nurse practitioner with a personal support worker? Wouldn't that cut out a whole lot of pardon the pun, BS of in between of having to go up this hierarchy to, because there is a shortage of nurses as well. So it's like, we should be looking at healthcare and the different ways of how to staff for healthcare. And different ways to utilize every single, because I can see now PSWs are being regulated professionals, into this kind of realm. And because at the end of the day, if you think about it, and this is what always kind of ticks me off, but we're so siloed in Ontario healthcare. Everything is so siloed. And they keep talking about unsiloing it. And that's wonderful. And they've done a great job in a lot of places. However, we're still very siloed. And there's still that kind of archaic element to, like, we're very like an old Victorian kind of way of looking at healthcare. We're not looking at it as new age and as innovative. And I like to think of, I do all the time think of ways that PSWs can be innovative. Like you say, you work in the correctional facilities taking care of, some inmates. You work with trafficked individuals. I mean, heartbreaking on both ends. However, PSWs also work in the correctional facilities. PSWs also work in the school board. It's like people don't realize that we're not just geriatric. So again, it's going back to that kind of mindset of, well, PSWs can only work with the geriatric because that's all they do. And I always respond with, well, activities of daily living, which is what the PSW does not start at 80 years old. Right? Like it starts when someone's born. And so I think this whole conversation has been so interesting, and we need to wrap it up here, but I want to give both of you an opportunity now just to have some last points that you want to be made, things that maybe you think the PSWs or our viewers need to know. I welcome it. Please go ahead.
I can start. I mean, I've seen a huge change in how PSWs have been, I would say, recognized in the 20 plus years since I've been a nurse practitioner. And when I think back to when I first started doing rounds in long-term care back in like 2003, and I was getting lots of great information from the PSWs, but they weren't documenting anywhere. Like and I was like, why aren't these people writing this stuff down? It was like, well, they're not regulated, they aren't, and all this natter, right? And so I think for PSWs, adding regulation is going to be a huge step up. And in the recognition pathway, not that it's going to change what any of them are doing work-wise, but I think it puts them on a more level playing field in order to get their voice heard a little bit better is what I'm noticing.
Yeah. Thank you. Thank you. Yeah, we've noticed that too. It was our hard work that had made it happen, which is great. Unfortunately, it took COVID for people to really realize that the PSW was beyond essential. And, we didn't have an army. We needed that army. So we're currently building that army. So God forbid anything like that happens again. But thank you for your kind words, Valerie. And true points. I really appreciate that. Michelle?
Yeah, this has been a great conversation. Boy, it's gone quickly, but you know what? We have an opportunity right now, and when we talk about government and investments right now, we have an opportunity to actually showcase solutions and educate others as thought leaders and experts in our field. So I do think that we can show how we continue to work together and how we can solve across the healthcare system. It's not a problem, it's an opportunity. And right now, I really need to think about the awareness of the roles. Like nurse practitioners, by the way, are less than, I think, 4% of all under the regulation of nurses, under the regulator, by the way, because we marry, obviously, nursing and medicine. So we are a very small group, but you can see if you amplify and come together with collective leadership and you own your body of knowledge and your science and move forward in that, I think we can make a difference. And PSWs do that. You have a critical mass of people that actually are making a difference across the healthcare system. And now to use their, not just their hands in direct patient care, but to show the leadership and some of how to navigate the system or to share words about patients and families and choices and to define how they can contribute and how they're being utilized in the best way as well. I think when we think about recruitment and retention right now, it matters, and coming together with some key great patient stories, and stories about how we contribute are really, really important. Stories do matter, and continuing to work together through our associations, I think, will come a long way. We do better together as well. And I want to thank you all, because to the Nurse Practitioner Association, PSWs are not invisible, you're invaluable. So thank you for that.
Thank you. I think that's a great way for us to end this podcast. For anyone who's interested in following the Nurse Practitioner Association of Ontario or learning more about nurse practitioners or to become a nurse practitioner, we are going to link their Facebook page below here on Facebook. And we're going to put up some information as well on how you guys can find out more information. I want to thank both of you ladies for joining me today. It was a pleasure. What a conversation. Probably going to have you come back so we can dive more into some of that conversation. But I really appreciate you guys coming out. Thank you to everyone who joined us for this podcast. Remember, we'll be back again next Friday, and Ian will be back with me. So I'm sure it's going to be a dirty one. All right, everyone. Enjoy your weekend. Thanks very much, everyone. And with that, we're going to say, OPSWA out.